Victoria is the first state in Australia to pass voluntary assisted dying laws. The Voluntary Assisted Dying Act 2017 provides a safe legal framework for people who are suffering and dying to choose the manner and timing of their death.
From the 19th of June 2019, Victorians at the end of life who are suffering and who meet strict eligibility criteria will be able to request access to voluntary assisted dying.
Voluntary assisted dying must be voluntary and initiated by the person themselves, and it will generally be self-administered, but can be administered by a medical practitioner if the person is not physically able to self-administer or digest the medication.
To access voluntary assisted dying, a person must meet all of the following eligibility criteria. You must be an adult. You must be an Australian citizen or permanent resident. You must live in Victoria and at least for 12 months. You must have the capacity to make a decision about voluntary assisted dying. You must be suffering from a disease, illness or medical condition which is advanced, progressive and incurable, and which will cause death. That death being expected to occur within 6 months or 12 months in the case of a neurodegenerative condition. And finally, the illness must be causing you suffering that cannot be relieved in a manner that you find tolerable. It is important to remember that only the person who is seeking information about or is seeking access to voluntary assisted dying may initiate the conversation with a health practitioner about voluntary assisted dying.
To access voluntary assisted dying, a person must complete the request and assessment process. They must also make 3 separate requests. First request to a medical practitioner, who if accepts becomes the coordinating medical practitioner. Then a written request signed by 2 independent witnesses, and a final request to the coordinating medical practitioner.
Health services will need to consider what role they play in voluntary assisted dying. 3 pathways have been developed which outline the models of care.
Pathway A is a single service likely to suit tertiary and some regional hospitals. Pathway B is a partnership model, while Pathway C is an information and support service model. Health services operators are encouraged to find out more in the Model of Care document.
A health service must consider the level of service it can safely provide to a person in its care in relation to the provision of voluntary assisted dying. The health service must also consider how best to support its staff during the implementation and administration phase of voluntary assisted dying.
Health services will need to educate staff about the new policies and guidelines in relation to voluntary assisted dying.
The Safety and Quality Guidance has been developed to provide support for the implementation of voluntary assisted dying within your organisation. It highlights factors for the health service to consider in the implementation of voluntary assisted dying.
The guidance tool includes accreditation standards, generally used in health and aged care, a checklist to support planning and tracking quality and safety, also some suggested performance indicators and sample data to support measurement.
Firstly, a health practitioner is not required to participate. If you do choose to participate, remember that you cannot initiate a discussion about voluntary assisted dying with a patient. I would encourage practitioners to go online to find out more about protections and the range of offences. Once a patient has requested access to voluntary assisted dying, there are 2 clear roles for the medical practitioner. The coordinating medical practitioner provides an assessment but also support for the person, while the consulting medical practitioner provides a second assessment.
Participating medical practitioners must have done the medical practitioner voluntary assisted dying training. The training takes approximately 4 to 6 hours and can be completed online.
A single statewide pharmacy service has been set up to dispense medications for voluntary assisted dying. Protocols are explained during the medical practitioner's training. There will be 4 voluntary assisted dying care navigator positions who will provide a statewide resource. People wanting to access voluntary assisted dying or health practitioners wanting information may contact the care navigators at any time.
Resources for organisations and more information about the role of health professionals in voluntary assisted dying can be found at the health.vic.gov.au website.